magazine, and we are at the AHCA NCAL Annual Convention and Expo in Phoenix, Arizona, and I'm talking today to Mary Kamp, who is Senior Vice President with RehabCare and Kindred. So Mary, what are you doing for providers that you feel they can't live without?
Well, I think that it has really become more and more important that the total patient is really supported through rehabilitation as well as nursing. So I think you look at the rehospitalization is a focus, and there's really a key role that rehabilitation plays in that, ensuring the patients are doing all that they can at a functional level. Also, I think what's even more critical is helping our partners understand that the care is really crosses settings, and that in the skilled nursing there's really a unique opportunity to really treat the patient for high value and quality at a price effective point as well. So I think we're trying to help them understand that patient-centered care crosses settings, and each setting has a really valuable role, and how do we work to keep that patient safe and transition to a lower level of care.
Mm-hmm. So what are the top 3 things providers are telling you that they need from you right now?
Well, I certainly think an understanding of the payment changes that are constantly occurring, the fact that they are being looked at as partners for ACOs and bundled payments, and so how do they position themselves to be prepared? And that's really by understanding patient care, patient protocols across the settings, partnering with the hospitals, understanding, I think a really important part is understanding what that patient needs to be successful as they transition. So if you're going to transition to home, what are the key pieces that will make that patient safe and not return back to the hospital or return back to a higher acuity level of facility?
And with regard to helping providers through healthcare reform, what has been easier than you anticipated?
I'm not sure that we really even know how healthcare reform has really impacted us. What certainly doesn't change is that patient-centered care means we have to take care of the patients who are more complex, that we have family members that need to be informed and collaborated with to best take care of that patient. So I think as we look at healthcare and the reform of healthcare, we've really tried just to focus on continuing to provide the right care for the right patient at the right time.
And what's keeping you up at night?
I think you asked the 3 things. One other area that probably is of great importance to everyone is that we're providing medically necessary services, but that the audit environment is at such a point that it's taking a lot of time and really in the process, and yet as we get through the whole process, we're demonstrating that these patients needed the care and that the rehabilitation services. So I think the scrutiny, not that we have anything to hide because we really believe in what we're doing, it's just that the processes are very, very time consuming, and it's important that providers understand how to meet those deadlines so that we can really continue to get the beneficiaries and the other patients what they need.
Great. Thank you very much.
Thank you.